Okay, so thank you, Sabine, and then also I thank Population Division to invite me over to talk on this topic, ensuring healthy lives and promoting well-being for all at all ages, and which is the theme for the next CPD which will be in April 2025. And I'm supposed to be talking about the case of Japan, how the health system evolved according to the population change, mainly for the population aging and then also population decline. So I have only 10 minutes. I'm going to speak quickly. So this is the overview of population modern period from Meiji period from 1872, and at that year it was 33 million people in the archipelago in Japan, and then it just go up to 128 million in 2010, and it started to decline after that, and as the most recent population census figure was 126 million people. So population decline is very steady trend. As you can see, the population is going to decline as in the same speed as the population increase in the past. And what is the thing is that the yellow line here is the proportion of elderly people. Here it is, we normally define it as 65 plus. And it is now about 30% of the total population is aged above 65. So 65 is not so much aged. But then we project that it's going to go up around 40% in 2070. But the difference of our country from the neighboring Asian countries or Latin American countries or even African country is that our number of elderly people is not going to increase so much from now on. Already we have been aged, and then also the total population is shrinking. So the number of elderly people, there is a small bit of increase in 2040 because of the population, the junior baby boomers, but still, our situation is that the number is going to be stable. That means that the number of beds needed for the healthcare for the elderly or the long-term care, maybe we do not have to increase so much. Having said that, I would like to talk about the history of our health system policies and reforms after the Second World War. So in 1961, we have achieved universal health coverage. And then during that time, we have a very good economic boom. It's like 10% per year economic increase, GDP increase. So at the time, we have put the free medical care for elderly. At the time, it was 70 plus. It was in 1973. And then it was good because old people did not go to a hospital before that because they think that they are sick because they are old. And then they thought that maybe it's shameful to go to the hospital in front of other younger people. But because we have made this free medical care in 1973, many old people are starting to be hospitalized in the hospital just because, as Agnes explained earlier, that in the case of Vietnam, also there are many preventable hospitalization, but because there is the need for the care for the elderly, and at the time we didn't have a good long-term care system, so that if it is free, then family is going to put the elderly to the hospital. So all of a sudden, the hospital filled with older people. So, and then of course it is costing a lot for hospital and then also the public health insurance. So in 1983, we have a reform to introduce partial payment for all, and then at least for the elderly people have to pay some part of their cost of medical care. So every now and then we have been having this health system reform, and then during the time this red line is the proportion of 60 of people age 65 plus. It will keep on increasing. So there is a more need for long-term care, which does not require acute, very high technology medical care. So we have tried to combine And then we have tried to make a new system for specifically for long-term care. So in 2000, we have introduced public long-term care insurance. And then in 2008, for the medical side, we have a new um, medical insurance system for older people, 75 plus. So according to the population trend, you have to adapt to it, you have to change the policy. So the next slide here, it is a bit too small, but well, it is the overview that when the population will age, there are many different policies which is related to aging as expressed in the MIPA, but here it is welfare and long-term care and health system and pension. So in the beginning, the welfare for the older people or the long-term care has been taken was considered as the welfare system. But if the number will increase of older person, then there is the more need for the medical or long-term care system. So when the aging start to progress, then people have to think about the mixture, how to give the long-term care and the medical care. And also for pension is another big issue. So this is about health spending in Japan in terms of social expenditure. So, social expenditure is the definition of OECD. Here, OECD SOX database. So we compile this data and then how much money we're spending from the tax money and then also from health insurance and also public pension funds. So from 1980 up to 2022, of course, the amount of social expenditure is keep on increasing. And here, very late, from 2020, there is a large increase because of COVID. But anyway, this red line explains the health proportion against, so this health, the social expenditure for the domain, for the field of health against GDP. So here it is keep on increasing. But you can see here there is a large increase because of COVID. And then also here there is a large increase in around 2010. It is because of the definition. So Agnes talked about the health expenditure against the budget. But also there is this definition of social expenditure by OECD. And then also ILO also make the the classification of social benefit, and then inside there is medical care. So how to define and then how to compare, that is again another issue. But what I want to say here, another thing is that yes, health is important, but when aging is going on, then old age, pension money, and then is also is a very important issue, and we have to talk together with the health issue as well. So about the uh, this is the life expectancy, a number of deaths of Japan. This green line is life expectancy. There is a small decrease because of the 2022, because of COVID. But also what I'd like to say is that before we have many deaths, this is the number of deaths, and then it is increasing because our population is aged population. So even though we have a higher life expectancy, we have many deaths. So death is a very common thing. And then one thing I would like, I will skip all this, but one thing I would like to mention about our society right now is that this is the cause of death throughout the history as much as we have the data. And recently, the number of senility death, the death caused by the decline of intrinsic capacity because of aging, it is increasing. And then this is a kind of problem. WHO does not recognize senility as a proper cause of death, but still there are so many deaths which cannot be described other than senility. So what to do with this and how to respond to this is one of the big issues for us. So let's move to the health. When we talk about his health system, we have to talk about healthcare workforce. So my time is limited. I will go very quickly, but this is the trend of health and care workforce. So we have first started to having the doctors, then midwives, and then pharmacists. And then after the war, along with the aging, the number of nurses increased sharply. And then it is about 1980 that we have created a specified the worker for the long-term care and social welfare, that is certified care worker and certified social worker, as you can see here. And here, this is the sharp rise of certified care worker. So to prepare for the long-term care and increasing elderly people, you need elderly people. And also how we can increase the number of nurses, or the number of these people. And one thing is that to keep on recruiting the life course approach for the healthcare workforce. So when we compare the Japan 2000 to Japan 2015, Japan 2000, there are many young women working in health and social work because at the time, young ladies become nurse. When they get married, they're happily married and they retire. But then now, the Japan Nursing Association try to recruit them and keep to make the system so that they can work throughout their life. So you can see the difference of this population pyramidal health and care workforce. And then of course, foreign care worker, it is important issue. This here on the left, this is the number of health workforce of foreign nationals in Japan. As you can see, it is increasing rapidly. But when we compare with the number of increase of Japanese nationals, it is much, much smaller. Then um, and then also when the population will decline, we have to think about the remote area where it is very difficult to have the health workforce in remote areas. We have this special survey called Survey on Non-Doctor District. And then right now in 2022, the district which have no data, the district which has no doctor, there are 557. It's been declining. And then the people living in these districts are 122,000 among 126 million people. So I think maybe I should stop here. So it is all about different pieces for the case of Japan. Thank you very much.
Thank you very much.